Welcome to True Health Tuesday, and the truth will set you free. Okay, the second half is going to be censored because some of the truth is dangerous truth. Okay, yes. Okay, breathing and disease reversal. Now, the second half is going to be on regulatory capture, which is kind of interesting. We started another YouTube video channel, even though the one that we've had up has been up for 15 years. We're saying we've said some things on there that are not appropriate, even though some of the videos have been up for 12 to 15 years and never offended anyone before. We're also on YouTube, Odyssey, Rumble, BitChute, but all those that are supporting Dr. B, VIP, if you're on that, you're going to be watching it through with its entirety. You're also going to get the PowerPoints and the handouts in PDF form. This is part of the apprenticeship program. We got an apprenticeship program the last Thursday every month, and we talk about anatomy, physiology, neurology. And this is a little bit, the breathing talk is a little segment out of that, but we went into greater detail because we're talking about anatomy and physiology. Also, Extreme Health Academy, if you have any health issues whatsoever, you get on there, you still get 2 weeks for free if you type in Bergman 14. Lungs, okay? Now, you got the nervous system, and it's in two parts. One part, the central nervous system, keeps you alive under stress, and that's sympathetic or fight or flight. The rest, digest, and repair also controls the lungs. So you have two nerve supplies going to the lungs, and they're under autonomic or automatic function. You can't make it go up or down. Now, the parasympathetic constricts the bronchioles. The sympathetic opens them up. So know that you have tubes in there that have muscular control that can constrict or close off, and they can dilate. This is why, have you ever seen athletic events where it's like inhalers are the one drug? Yeah, guess why? Sympathetic stimulant. It's going to increase performance, and it's legal. I know, kind of cool. You know, it's not like, gender identity that also has different testosterone issues. But also, now here's the way to remember this, okay? C3, C4, C5 keeps you alive. Now, what does that mean? That means the third, fourth, and fifth cervical vertebrae, the nerve that comes out of there is called the phrenic nerve, the diaphragm. Okay, and this is how you actually breathe. And we're going to go over literally how to breathe disease away, how to oxygenate the system. But also, you've got the cardiac and respiratory center at the top of the neck. So if you have any kind of a neck issue, do you think you might have good diaphragmatic function or poor? Let's look at the lungs. Now, the lungs want to collapse. The ribs want to pop out. So there's always this little tug of war, and there's a vacuum in between. So when you're breathing, you get this space. So this is why when you're running, your chest doesn't catch on fire. I'm totally kidding. You're not. That would be a really bad design for an animal species on the planet. But also think about this, okay? Let's say you're out in the woods. Let's say somebody has a broken rib or they pierce that lung cavity. If you see the rib cage popping out on that side, you're looking at a collapsed lung. So for first aid, when you look at the integrity of both sides, if there is any physical trauma and you see that rib cage popping out, it means the lung is more likely collapsed underneath. So this gives you a little clue on how the body works. But when you breathe in, the diaphragm comes down, drawing the air in, kind of like drawing, getting those squirt guns that you got to draw in. So kind of like that, you're drawing it in. When you exhale, it's passive because the lungs want to collapse. Now, you've got this diaphragm. The diaphragm has a couple of holes in it. Wait, where does the nerve that supplies the diaphragm come out of? C3, C4, C5, okay? Keeps you alive. So you've got this innervation in the neck. Now, the diaphragm, when you're breathing correctly, that comes down, you've got a couple of holes in there. One, you've got the big red aorta coming down. You got the inferior vena cava coming up, and you got the tube, the esophagus, the food tube that goes right through the middle. So you might think, wait a second, if that muscle lost its integrity, Could that be a contributing factor to hiatal hernias? Yeah, that's exactly what a hiatal hernia is. Could it be a contributing factor to reflux? Absolutely. So wait a second. So does that mean if you got a compromised nerve in the neck and you got compromised diaphragmatic function, you could end up with some digestive disorders? Wow, isn't that weird? So let's go over the structure of the lungs. Now, you've got these little tiny sacs called alveoli, and they're amazing. Okay, they've got this clear fluid on the inside that kind of looks like WD-40, and it allows carbon dioxide and oxygen transfer. Because when you're expanding, contracting, you get all of these little air sacs opening and closing. Now, when I was teaching human dissection, if you take a lung out of a standard healthy human and cut it right in the middle, these sacs are so small. It looks almost like it's solid, like if you're in the kitchen cutting open a liver. If you cut into someone who's got damage to the lungs, and I mean severe damage, okay, you'll even see these people in regular stores. Their chest is going to be popped out. It's called barrel chest. And this is what an emphysema victim looks like. When you look at their lung tissue, it's amazing. It looks like a moth-eaten, sweater. Big old huge holes run down in it. So you have this oxygen carbon dioxide transfer that takes place in these alveoli. Now, if you are dehydrated, or if you have a condition called asthma, which asthma is a problem of the smooth muscle control of the lungs, not actually the lungs, but you'll have 10 times the amount of mucus in those lungs as opposed to the surfactant that you should have. So this means, does that mean that asthmatics are possibly dehydrated, or they're not getting the fluid in the lungs, or there's some other problem with that? Absolutely. Now, your body has a very narrow pH, okay, and this is acid-base balance. Now, watch this. I'm going to alkalinize right in front of you. Yes, the front row should close their eyes. Yeah, I just got rid of some carbon dioxide. I'm alkalinizing. Yeah, I know. It scared you, did it? So when you look at this, you got a 7.35 to 7.45 pH. If you're above or below a half a point, you're dead. So you got these sensors in the neck. So you got the heart here, and coming off the heart, you got the common carotid coming up, and it splits in internal and external. Right at that split, right in the middle of your neck, are two sensors. One senses the carbon dioxide, and so when the carbon dioxide is up, the heart rate has to go up faster to get more blood supply to the lungs to get rid of the carbon dioxide. However, when the carbon dioxide goes too low, the body becomes too basic, okay? And that'll screw up the pH. So then the heart rate slows down to get that carbon dioxide back up. So there's perspiration, bowel movement, urination. There's a bunch of things that regulate pH. But this is one of the sensors in the neck. And if you ever heard that somebody doing a chokehold improperly can stop the heart, that's why you're affecting that chemo and baroreceptor, pressure and chemical receptor inside of the neck. Now, so when we look at this, there is a reflex in there. So your body is always monitoring itself. So if the carbon dioxide level is too high, it's going to send a signal down. So the nervous system is intimately involved in the heart function. It's interesting because we're looking at a couple of, when we talk about heart health, and we're not going to talk about heart health tonight, but all of the stents, the angioplasties, the bypass surgeries, and the clogged artery theory of heart issues, we're going to cover that in the next apprenticeship program. And you're going to find out that hospitals would close if they didn't have that cardiac ward to generate the income. And it's completely of no avail. It doesn't really work. And we'll show you to clean arteries. So basic, carbon dioxide levels go up, heart rate goes up. Carbon dioxide levels go down, heart rate slows down. I mean, it's a brilliant system. Now, it's interesting, a couple of articles here on how chiropractic adjustments, and I love this one, no adverse effects were recorded. We conclude that restoration of the atlas, which is the top bone in the neck, is associated with a marked sustained reduction in blood pressure similar to the use of a 2-drug combination therapy. Really? What are the side effects of a 2-drug combination therapy? Well, gee, we can talk about kidney damage, we can talk about dizziness, stroke, balance issues. What's the side effect of restoring the normal nerve supply getting pressure off of the central nervous system, allowing the body to function naturally. That's what a chiropractor does. Chiropractors don't fix anything. They remove the interference so your body can adapt to the environment better. That's it. What's the side effect of that? It's called health. Okay, so posture. Okay, if your posture is down and around, this is an issue. Okay, now how many people, and just try it, sit up nice and straight and round your shoulders and try taking a deep breath. It ain't working real well. Okay, and you're like this, or your students are like this, okay, or your nephew's like this watching TV, and you sit like this. Oh my God, that makes a big difference. So just a posture analysis of your neighbor, your friends, your spouse, everything, to see if that shape of the spine is good or not good. I used to say posture is the window to how your physiology is. Now there's an exercise, and this is one of the most painful exercises you're ever going to do. Okay, and now normally this is one of the foam pieces that we have. Typically we use it for sitting, driving, everything. It's the bottom of the elbow is the bottom of the roll. It's placed at the junction of the thoracolumbar junction, 20 minutes in, 10 minutes out. This is how it's used. It's very hard to compress, okay, and it works really well. You can also use a plastic water bottle. That's not this exercise. This exercise is painful and effective. Okay, because if you got this rounded over shoulder, that's because you're rounding it over and you're literally opening up the holes in the back of your spine where the nerves come out. So if you have compression of the discs, every time you breathe, there might be a little sharp pain. When you start laying on this, and it's painful as all heck, and you can see, this is one of the docs we have down in Mexico. Thank God, I mean, really good sport, because this is not comfortable. I'm laying him down on this, and there's instantly going to be a sharp pain on the front. And so what you want to do, if you're going to lay on something like this, you might want to start off with a rolled up towel. You might want to start with a folded towel. Okay, if you've got Parkinson's, because I was just talking to a patient today who's standing like this, and I said, look, try it with nothing. Okay, just lay down. You may need to have a pillow or a box or something to lay the head on, because eventually the head's going to be laying all the way back. But you have to deep breathe. Deep breathing on this exercise is hugely important, because those discs that separate the vertebrae are 70% fluid. And when you increase what's called intrathecal pressure, you're forcing fluid back into those discs. So deep breathing during this will decrease the symptoms or the painful symptoms almost immediately. If you can stay on it for 4 to 5 minutes, you're stretching all the intercostals, you're creating negative pressure on the disc, you're hydrating everything. Best exercise for any kind of office worker in the world, but that's going to help. The reason it's going to help, plus it's going to also help increase the volume. And when we get into diaphragmatic breathing in a minute, it's going to be hugely important. Asthma is a prominent disease of the privileged class, according to the World Health Organization. Luckily, with all their interventions in the last 2 years, there won't be a privileged class, so they'll solve the asthma issue. Nobody? Gee, I get more laughs from Bible humor. Okay. A disease of affluent society, according to the Lancet. Now, it's interesting. European Respiratory Journal, Lancet, British Medical Journal, and Journal of Pediatrics say if you're raised around dirt, okay, you got pets, you got a bunch of families, that are living in the same house. And I'm talking not the single child with 2 parents, and each of the parents has Purell bag hanging next to them because they've been watching the TV for 2 years, so they're trying to disinfect everything. Can you give me an amen if you got a relative like that? Amen. Irritating as all heck. So isn't that drinking unpasteurized milk is protective from asthma? Wait a second, weren't we talking about the lungs, that the nervous system can constrict and dilate, and that asthma is actually a constriction and there's more mucus in there? So there's more mucus in the lungs with asthma. And if you're exposed to bacteria from the raw milk, to bacteria and viruses, funguses, bacteria, mold, everything from animals, from dirt, from playing, that it protects you. Isn't that interesting? Now, children who drank raw milk had 41% reduced chance of asthma, reduction in hay fever. So why is this? Well, for one, you are a symbiote. You are an ecosystem that's designed to live on the planet. Wait, see the person out there with a mask? They're not designed to live on the planet. They're scared of their own shadow. Okay? I'm just saying you folks here right now are designed to live on the planet. Okay? But you're an ecosystem. You got 70 trillion cells. All these cells are alive. They're reproducing. They're doing all sorts of different activities. You have 10 times the amount of your cells in your body of bacteria. And this is bacteria in your nose, on your eyes, in your hair, on your skin. It's everywhere. You got 2 to 3 pounds in your gut. And without this bacteria, you can't produce a lot of B vitamins. I mean, it's absolutely incredible, the relationship you have with this. It's called normal flora. Okay, and if you damage that normal flora, have you ever heard of probiotics, prebiotics, fermented foods, how important that is? Yeah, because 80 to 90% of your immune system is in your gut. And if you damage that ecosystem that you are responsible for, it destroys your body's ability to adapt to the environment. Now, bacteria eat yeast. Now, there's also certain viruses. Without viruses, you would die. You would die. Philip Sharp, Nobel Prize winner. We humans are well over 50% viral. Bacteriophages, some of these viruses, without viruses, you die. You die. So if you are talking to a relative that is, listening 100% to CNN, okay, or to Insanity, any intervention you do, if it helps your immune system or how you adapt on the planet, remember, I can't say anything about this, then it's probably good. If it weakens your ecosystem and how you're going to adapt, it's going to be bad. Okay, even it does give you better control if you're a government. Antibiotic use. Wait, what is antibiotic? Antibiotic is a poisonous mold that destroys bacteria. Typically, it's wide band. Now, if you take it internally, it's going to get in your bloodstream, destroy the gut flora. Okay, increased risk of developing asthma. Journal of Clinical and Experimental Allergy. There's an association between antibiotic use in the first year and symptoms of asthma, rhinoconjunctivitis, and eczema in children 6 and 7 years old. Each time you take an antibiotic, it destroys your gut flora. Just had a patient today with anxiety and stress. My wife's got a friend who's in the medical world, and she took an antibiotic for urinary tract infection. She's self-medicating because she's a doctor. She can know that, and in fact, if you have any problems, ask her because she's a doctor. She'll know if it's right for you. All seeing, all knowing. It's amazing. It's like Harry Potter. She developed anxiety and stress and depression from the antibiotic. And she calls up my sweetheart and says, hey, I got anxiety, stress, and depression. And Sarah says, well, probably the antibiotic you just took because that destroys the gut flora. And that's where neurotransmitters are produced. And a leaky gut can cause an inflammatory response. And I'm going, holy shit, she listened. It's like, damn. Just really, really cool. So majority of babies given Tylenol. Now, what doctor would recommend Tylenol? Now, Tylenol or acetaminophen depletes glutathione, and that's the only thing that protects the brain, glutathione. And there's a barrier between the blood and the brain. Let's look at this. So you give somebody acetaminophen, which destroys the joint cartilage. They don't actually know the mechanism of action. It destroys proteoglycan production of the building block of cartilage. But it also increases, if you're taking Tylenol, once a year, you have a 70% increase in asthma. That's not one day, every day for a year. It's once in a year. Let's say you'd have Tylenol once a month or more. You have a 540% increase in asthma. Why would you take this? When someone's in pain, fix the pain, find the source of it, get some omega-3, some vitamin C, some antioxidants. It'll help. Pathophysiology or intelligence. The normal response that you have in your lungs, if you're breathing in stuff that you can't recognize, like dirt or pollens, your airways become inflamed. This is why if you have a stuffy nose, it's an intelligent response by the body to something that you don't recognize. And that inflammation draws blood to the area and develops an immune system response. This is called normal. Okay, not in our hypersensitive psychotic society we're living in now. In 2014, the New England Journal of Medicine had an article that said, please sneeze on my child. Okay, so we haven't always been bacteria or viral phobic. Now, in the asthmatic lung, there's a hypersensitization. See, when we're talking a normal response, you need a normal gut flora, you need normal nerve supply, and then you're going to mount an inflammatory response because inflammation, like if you scratch something, inflammation breaks those cells, histamines are released, and it draws blood and immune system cells to that area of tissue damage or to the immune system response. This is totally normal. The asthmatic has a hypersensitization. Now, what kind of thing? Now, just thinking about it right now, you've got about 25% of our population with asthma currently. That wasn't like this 20, 30, 40, 50 years ago. So if you had about 30 to 40 people in your class in school, like I did, went to Catholic school and then public school, I can't remember anybody in the whole class that had an inhaler. I think there's probably one sick kid in the school that had one. But now if you're in a class of 40, 10 of those kids in there have asthma inhalers. Okay, you got 10 more taking other drugs like antipsychotics and other things. So it's a real drug population. So let's look at this. Th1 and Th2 response. A Th1 response to any kind of environmental stimulus needs a good gut flora. You develop humoral and cellular responses, but Th2 is just inflammatory. So if you're stimulating just inflammation, like let's say you're scratched by a rose bush, you don't need to mount humoral and cellular responses to a scratch from a rose bush. That's no big deal. It's just an inflammatory response. Bam, you generate some tissue. You never need to worry about it again. But let's say that there's a medical procedure that triggers a Th2 response that we can't talk about. Okay, does that mean we're sensitizing the entire population? And so we would see more inflammatory bowel diseases. We would see inflammatory lung diseases, such as asthma, bronchitis. We would see inflammatory brain diseases, such as autism or things like that. So what kind of things would create an inflammatory response? Well, this is at a UCA School of Public Health and Department. And I know when you're looking at this slide, you're thinking, God, doesn't that look like one of Fauci's emails? No, I had to censor it myself. Okay, so we call it VENSERD. VENSERD, okay? VENSERD and asthma. The odds of having an allergy-related respiratory symptom in the past 12 months was 63% greater among VENSERD subjects rather than unVENSERD subjects. The association between VENSERD and subsequent allergies and symptoms is greatest among children 5 through 10 years old. DPT or tetanus VENSERDs appeared to increase the risk of allergies and respiratory symptoms in children and adolescents. Okay, that was kind of cool, okay? I think it's better than Voldemort, okay, but you get the gist. Okay, viruses are beneficial for asthma out of the British Medical Journal. Wait a second. Does that mean we shouldn't be afraid of each other and our environment, that we're designed to live here? Whoa. Early childhood infections and subsequent development of asthma. Other than lower respiratory tract infections, early life may reduce the risk of developing asthma. So repeated viral infections are actually good for you. And remember what we used to call kids snot-nosed little kids? Okay, because they are snotty-nosed little kids. You know, they're running around. Their immune system hasn't been educated. They got a mounted defense, okay, and develop all your defenses. So as you get older, you get less and less responses. Like you don't see people in their 60s and 70s. You see that snotty-nosed 70-year-old. No, they've already been on the planet almost 3/4 of a century. Gosh, viruses will bounce off of them like bullets off of Superman. Okay, but now we've got, remember, you got a intimate relationship. Anything that you do that damages your bacteria or damages your virus will damage you. You need these. It's like saying, yeah, I want to kill my cells. You have an ecosystem. Glyphosate, powerful selective antibiotic that kills beneficial but not pathogenic microorganisms in the soil. Glyphosate is the most important factor in development of multiple chronic diseases and conditions that have been prevalent in Western societies. Okay, so let's go to the God. Okay, remember, 2 years ago, it wasn't just a flatten the curve. Your religion was replaced. Okay, if you go to a church on a regular basis, did they close? Some did. Okay, so we now have a new God. It's called the God of CDC. So let's see what these gods, because you have to follow their, I can't call it science. Okay, their propaganda. Okay. Chronic obstructive pulmonary disease refers to a group of diseases that block airflow and related problems. It includes emphysema, chronic bronchitis. More than 16 million Americans have this disease. Millions more suffer but haven't been diagnosed. So let's look at this pamphlet, Management of the Outpatient and Chronic Obstructive Pulmonary Disease. So, and it's interesting because they have strength in category, what it's supposed to be, disease classifications. We suggest postbronchial spirometer, insufficient evidence to recommend against any spleen. So let's start from 3 on. Let's see what the great God, okay, has spoken, because it's now religion, because you can't say science, because science is always full of discussion. I mean, you can have 2 scientific experts that discuss the relevance of what they're thinking about. And if anybody wants to understand this, has science changed? Yeah, all the friggin' time. All the time. When you look at geology or astronomy or mathematics, okay, you're looking at anthropology. Every science is constantly changing. You get these experts that say, look, the world is totally flat. Okay, or the dynamics of the planets, okay, are totally different. It's always changing. 3, we recommend cessation of smoking for prevention and risk of reduction. That makes sense. You're damaging lung tissue. Okay. We suggest routine injectable medical procedure for influenza. But wait, didn't we just put that those Venserds actually create an inflammatory response? Okay, let's look at the next one. A long-acting drug, muscarinic antagonist, first line of therapy. So a drug that alters the mucus and the production, or the first line of defense of a body. And then the 6th one, inhaled long-acting beta antagonist. Wait a second, that's a sympathetic stimulant. Wouldn't that put you in a stress state? Let's look at 7, corticosteroids. Well, corticosteroids actually destroy joint cartilage and increase your risk of cancer. Question 8, dyspnea, recommend using long-acting this and long-acting anti-muscarinic. Okay, good, more drugs. 9, long-acting beta, more drugs. 10, long-acting muscarinic, more drugs. 11, insufficient use, eosinophilia, asthma, guide additional therapy. 12, inhaled steroids. Again, and I know when I say inhaled steroids, you're thinking, gee whiz, doesn't that weaken the immune system, weaken bones, and weaken, increase your risk of cancer? Yeah, it does. Okay, 13, NAC. One of the only few things on here that is actually good for you. Okay, there's not enough evidence for them to recommend for or against, of course, because it's not a pharmaceutical product. 14, C-reactive protein, the antibiotics. Interesting. There's not enough evidence for or against antibiotics. That's the first drug they couldn't really recommend. Long-term oxygen therapy, stabilizing, so getting oxygen in the system. Long-term supplement of oxygen. Again, COPD, starting cardio beta blockers, so more drugs, smoking cessation. So it's pretty much drug after drug after drug, or we're going to force oxygen in you because you're turning blue and your perfusion is not good. Well, what about, just imagine if you're designed to live here. Look at PubMed, National Institute of Health, 29 patients they had with moderate to severe COPD. Okay, they had them breathe normally for 4 minutes. How does that work? Aren't you breathing right now? Okay, quick, act natural. You know? Okay, so normally for 4 minutes, and then you diaphragmatic breathe for 2 minutes, and then breathe normally for 4 minutes, and what they found was amazing. And these in chronic obstructive pulmonary, amazing. Okay, increased tidal volume. That means you're getting rid of more oxygen and taking it in. Reduction in breathing frequency. This means you're breathing in a more normal rhythm. Leads to higher ventilation and oxygen saturation, reduced dead space. If you've been alive back in the 70s, when they put you on a ventilator, you're pretty much going to die because you develop pneumonia and die. What they did is they built in a yawn in long-term respirators, and that's to get rid of the dead space. Because if you're only breathing in like this, you got to take a yawn in there so you can expand the air into areas that don't normally get expanded. That way it prevents pneumonia. Isn't that interesting? Like if you ever saw Christopher Reeve, when he was talking, every fifth or sixth breath or so, it would expand his chest. Interesting. But this diaphragmatic breathing makes that work. And what they found is that if you didn't do it, you didn't have the results. So now here's another one, National Institute of Health, diaphragmatic breathing. Wait a second. So this will help, diaphragmatic breathing will help the brain, the cardiovascular system, respiratory, gastrointestinal, and modulation of the autonomic nervous system, exercise capacity, respiratory function, reduces stress, treats eating disorders, chronic functional constipation. Why would this help eating disorders and constipation? I'm telling you to breathe because you have the diaphragm that's manipulating and moving all the organs in the gut. So you've got the intestines, you've got the liver and the stomach. Okay, and all of this has lymph or fluid like the sewer system. And the more you actually utilize the body the way it's supposed to be utilized, you have better function. This means that lymph fluid is going to be produced and you're literally massaging your organs when you're breathing correctly. Helps with high blood pressure. No kidding. You've got the sensor in your neck. We know that if you oxygenate, that slows down the heart rate. Migraine, anxiety. That little 3-pound brain burns 80 to 90% of your body's oxygen. Helps cancer, helps reflux. Reflux, no kidding. Because you've got the esophagus that goes through that diaphragm. And if you're diaphragmatic breathing, you're strengthening the diaphragm. That increases the tone of that so the stomach isn't going to pooch up inside of the pulmonary cavity. Oh my gosh, it can't be this easy. So I'm going to tell you something that works better than the CDC, and you could do it right here in your freaking chair. Heart failure it helps with. So let's look at this. One hand goes here. One hand goes here. Okay. Now, what I would tell patients, because they always forget how to diaphragmatic breathe. If you got like a little baby at home, like your kid is already diaphragmatic breathing, she's smart. Okay. She learned it from her parents. But think about this. Okay. If I'm going to punch you in the stomach, and this is what I tell all my patients, I'm going to punch you in the stomach, put one hand there. And they're look scared for a second, and then they think, okay, you're kidding, you're nuts, okay? But think what happens when you're punched in the stomach, the air comes out. So it's more like, then you breathe in, and what you want to do is breathe in through the nose, out through the mouth. So on 3, you're going to push in the stomach on 3. 1, 2, 3. Now breathe in and push out. Blow out and push in. Breathe in and push out. So you're physically moving your stomach in and out. Blow out and push in. Breathe in and push out. So that breathing in, pushing out. Now, if you're breathing and your chest is moving, okay, then you're not breathing correctly. Okay? And this is why the majority of people, when I say take a deep breath, they'll go like this. Their tummy goes in and their chest goes up. Why? Because in America, not everybody can have a well-developed ab like mine. So they want to accentuate their chest. So diaphragmatic breathe 10 minutes before you go to bed. Diaphragmatic breathe when you get up. Diaphragmatic breathe while you're driving and commuting. Diaphragmatic breathe all throughout the day. And eventually it's going to be normal for you. Then vitamin C. Okay, if you got somebody that smokes, they're smoking because that generates dopamine. If they're smoking, they need that. They're in an extremely stressed state. Suggest organic tobacco so it has less pesticides and get them on high dose vitamin C. That's it. Okay, and then deal with their stressors. It's the same thing with addicts, and I'm talking prescription or illegal. They're trying to solve an underlying issue. Vitamin C protects your lungs, but you can also eat it. Strawberries, tomatoes, broccoli, kiwi. When we look at vitamin A, fantastic in carrot juice, duck liver, pasture-raised eggs, butter. And this turns into beta carotene, which actually helps the lungs. You've got multiple sweet potatoes, kale, spinach, all of this stuff. Let food be your medicine and medicine be your food. So you're eating foods that your body can utilize. And hopefully some of this stuff is fermented so you can replenish your bacteria. Now, all of this stuff we're talking about, how can you help? Just think of that list, okay? Blood pressure, digestive disorders, anxiety, stress, depression, breathing. It can't be that simple, okay? But it is. It is. Practice it every day. Now, that so far, because I disrespected the new religion, the CDC, and I joked around with the Vensurds, okay? That, in another few months, I guarantee I won't be able to talk about. The next part we're going into is dangerous. We're going to talk about regulatory capture. And this is something that is, it's interesting. Mr. Kennedy, Robert Kennedy, when I was talking to him, because he does come down here, and this was like about a year and a half ago, I was really upset with the forced medical procedure, the forced this, the forced that. And he said, no, the biggest thing is the censorship, that it's not an open forum, that there's not a level playing field, that you can't have a debate on what you think is correct, and I can't discuss my data points with you and have a civil discussion. We can't have that. So we're going to get into it now. But John is going to, so I'll see you later next week, Facebook and YouTube, and those that are on the Dr. B VIP, you just keep watching, buddy.